going to talk about sumatriptan. It's a drug my aunt takes for migraine headaches. Sumatriptan is used to treat migraines. It helps relieve headache pain and other migraine symptoms, including nausea, vomiting, sensitivity to light and sound. Prompt treatment helps you return to a normal routine and may decrease your need for further pain medication. Sumatriptan belongs to a class of drugs known as triptans. It affects a certain natural substance called serotonin that causes narrowing of blood vessels in the brain. It may also relieve pain by affecting certain nerves in the brain. Sumatriptan does not prevent future migraines or lessen how often you might get the attacks. What sumatriptan targets is, it's a serotonin 5-HT receptor. It's an agonist, which is a triptan. It works by narrowing blood vessels in the brain, which helps to relieve migraine and cluster headaches. The specific receptor subtype it activates is present in the cranial and baluster arteries. Activations of these receptors causes vasoconstriction of those dilated arteries. Sumatriptan also is shown to decrease the activity of the trigeminal nerve. The importance in development is triptans are believed to exert their effects through vasoconstriction, leading to reduce the carotid arterial circulation without affecting the cerebral blood flow. Peripheral neuronal inhibition or inhibition of transmission through second-order neurons of the trigemocervical complex. Sumatriptan is administered through tablet, through injection, and through nasal spray. Some of the side effects of sumatriptan are anxiety, restlessness, fever, sweating, muscle spasms, twitching, diarrhea, seeing or hearing things that are not really there, chest pain, trouble breathing, faintness, dizziness, and seizures. The alternate names for sumatriptan are Imitrex, Imigran, Sumatran, Sumatriptanan, Sumanex, and Trexamet. The molecular formula for sumatriptan is carbon 14, hydrogen 21, nitrogen 3, oxygen 2, and sulfur. The IPAC name is 1,3,2-dimethylano ethyl 1-indole 5-N-methylmethanous sulfonic sulfonamide, which is a really long IUPAC name. Here's the structure of it when it's put in chemical form. The solubility of sumatriptan is it's very soluble in water. It's soluble in DMSO. It's very slightly soluble in methanol, and it's completely insoluble in ethanol and ether. It's a solid powder. It's soluble in water. Its melting point is between 165 and 166 degrees Celsius. Its boiling point is 497.7 degrees Celsius. And its functional groups is it has an amino group, an alkene, sulfosulfamide, again, and there's only one chiral center in this compound. And I got my references through the National Library of Medicine's medical subject heading. So, let me ask you, do you guys know what the, are you guys pretty clear on the side effects of sumatriptan?
Yes, chest pains and dizziness are two of them.
Okay. So, what this does, I'm sure one of your questions is, how is that serotonin working? The serotonin, it's a agonist receptor, which it's going to grab onto your 5-HT receptor. It works by narrowing the blood vessels. When you're having a headache, you're just really pounding and flexing. Well, it's narrowing your blood vessels, and it's calming the blood going through your carotid artery. So it's really kind of relaxing what's going on in your head.
Mhm.
I know you know by taking the pills.
Yeah.
Okay, well, thank you guys so much for listening to my story.
Thank you.